No maira, it's manhiri tuarangi e. Haere maira, no maira, haere maira. Kia ora tātou katoa. Ko heri e te rangi tōku ingo, ko Ngāti Porou me ngā tūwhare toa tōku iwi, ko tākuira reo ko tāwai tōku kaumātua. Ko neira te rangi tōku mama. Tērā wā koutou katoa. Kia ora. Kia ora. My name's Heria, and I'm the kaiwhakahaere for Whare Haura. We're a charity that puts whare sensors into homes so that we can measure the effect of the home on the family. So first I'm going to tell you the why we do it. Effectively, we have 3 wahine toa in technology, and to be honest, we have our own day jobs. But we had a why. All of us have our own stories, and this is mine as to why. This is Tāwai Te Rangi. She's an 83-year-old matriarch of the Te Rangi Kāmokura whānau, and she's my grandmother. Together with my grandfather, Tākuira, they raised 5 generations over 45 years in a state house in Porirua in Ascot Park. This is me, my cousins, my mum, my aunts and uncle outside that same state home after we had cleaned it out because my grandmother had died. She had first had a cold. We knew that she had a cold, we just kept an eye on her. But 3 weeks later, she had pneumonia, and so we ended up in the hospital in A&E having x-rays where they showed us the infection had taken her entire left lung and the bottom of her right. She ended up dying from causes due to pneumonia 4 days later. That's the kind of time frame we're talking about. That kind of speed, that kind of immediacy when it comes to our kaumātua and children. I'm sure if you got onto Google today, you'll be able to find other cases. 1/3 of New Zealand homes are cold and damp. It's a known fact. This is from the Housing Building Society. And 1 in 6 Kiwis have a respiratory illness. I've got asthma, had it since I was a kid. 700 people, $5.5 billion per annum, 3rd leading cause of death in New Zealand. When we think about those numbers, it's quite easy to see the graphic and go, oh, that's okay, that's not me. But then if you really actually think about it, you can probably find a niece, a nephew, an aunt, or an uncle. Because I started looking up how my kaumātua and my grandparents had died. One had died from asthma, another one had died from pneumonia, and my grandfather had died from pneumonia as well. This is a quote from Dr. Philippa Houghton Chapman. Fantastic, badass lady. We all know or have lived in those homes where we know where that cold room is, so we don't put the kids in there. We know where that wardrobe is that's damp, so we don't actually put clothes in there. We know that if we pull our bed out from the walls, there'll be black mould where the wall had touched the bed. Then you've got to ask yourself, was I sick over that winter because of that black mould? Maybe. But 18 degrees, World Health recommendations for a healthy home. We created Whare Haura because with our technical skill sets, we can build these things. Software development, been doing it for 15 years. Brenda's been in hardware for God knows how long. And so we all came up with, but Brenda mostly, came up with what is not measured is not managed. Because we all know, right? We all know, but we don't actually do anything about it because we aren't absolutely sure. There is no evidence. So we created Whare Haura. Whare Haura is a charity, it is for the resident. We don't actually expect to make any money ever. Our technology isn't the most flashiest, and to be honest, we just buy our components off of AliExpress. But it's that kind of reuse. The technology for this is actually done in code clubs for schools because it's that accessible. We want it to be that simple. We have two business models. One is for community, all about the community. We go in, we teach them how to build their own sensors, their own gateways, and then we leave them with a health professional that is already in their community, but we pay them to support them in, making sure that their sensors are up and running. We also have the other model, the commercial model, because in order for this to keep going, to have legs, we're going to need money. And so we're in talks to start scaling out, to start creating house sets, so that if you're not low socioeconomic or you're not in one of our courses, you can buy a set. And out of that money, we'll be able to give another set to someone else or to fund our community in Noho Marae. This is how our whare sensors work. So we teach the whānau how to build the sensors, and then you put one sensor in each room. We teach you how to make a gateway. The gateway pulls the data from the whare sensors, pushes it up to the cloud, then to the dashboard. In practice, here's our first prototype, don't laugh, and it's not a fire hazard. This is the first one that Brenda ever made. It was big, clunky, there's an Arduino Uno in there, wires all over the place, a big power cord, but it worked. She was able to measure her child's room, and out of that, she was able to realise that it was making her child sick. So she moved it, found the next best room, and then moved her child there. That's how easy it is. Because if you know, you can make changes. We're on our fourth prototype. This is like the pre, just to see if it works. And this is our fourth go. So we went to Kahau, the funding, that's the partnership between TPK and MB, and we pitched for some money. And out of that we got 150K, and we were able to miniaturize. Because as you saw, the last one was like this big. But you need one in each room. Kids sometimes unplug them because they want to charge their phone, or someone might kick it, or any number of things. So we're miniaturizing. That's our new PCB, our new printed circuit board, and it's only about that big. And here's our new cases, and it's battery powered. Because some of the feedback that we got from Kahau was A, it's too big, B, what happens if they don't have a power source, and C, what happens if they don't have internet. We'll come to the internet part soon. So that's where you put in the batteries, that's the PCB, and then you just slap a command strip adhesive on the back, turn it on, put it on the wall. That's it. This is what the dashboard looks like. This is our new iteration. At the moment, it's got all the data underneath it, but you can tell that it was a bunch of devs that did it. It works, but it doesn't look like this. So as a resident, I'll be able to go onto the web, log in, I'll be able to do the setup. So if I've got new sensors or a new gateway, I'll be able to tell them that gateway is mine, those sensors are mine, add in any whānau that you want to have access as well. It might be that this is your nan's house, and so I want access. Then you'll break it out, each sensor per room. So we've got temperature and humidity, and then because this tells you the data, I think it's 10 minutes. Every 10 minutes it takes a reading. You can change that too, depending on what your need is. Say if you were in a batch, you wouldn't need that, right? And then we give you an interpretation of what that data means. Slightly too cold, but otherwise healthy, because we know the basics, right, from World Health Organization, 18 degrees. We also know that humidity, like this one obviously has a sparkle in there. Yeah. And this one is too cold, but the humidity is okay. But it's still way too cold. A child in there over time would definitely get sick. So we've got the temperature, humidity for right now, and then if you clicked on analyze, it'll give you the data over time. We give you a breakdown of what it is, but we also calculate the dew point. So that's when moisture in the air condenses enough to form moisture, actual pools of water. That's on windowsills, windows, maybe in the carpet, who knows. And then we give it a rating. Just because we can tell, temperature is well above dew point, room appears healthy, warm and dry, because that's what we're going for, right? Warm and dry. Then we have the readings. You can switch between temperature or humidity so that you know what's going on here. Why is the humidity so high, but the temperature is quite low? Something might have happened there, so it pays to check, right? If you know, then you can check. Something occurs at that time. Maybe it's daily, who knows? We also are able to tell them when it's mediocre or when it's really bad. So we're working with Otago University to ensure that our interpretation of the data is correct. We take a first crack at it because that's what we do, and then they correct us because they are really, really helpful. They don't need to be, but they are. So we try to make sure that we don't say anything that's really dumb. And we show them our sources of where we got the information from, usually World Health Organization recommendations. But the interpretation of that is tricky, and so we go to them to make sure we're okay. But yes, it means that we can give health warnings, and this is the web version. On the mobile phone, we'll give them notifications. Hey, so for instance, you put the kids to bed at 8 o'clock. It was quite warm then. You left the window open. At about, 10, 11, it got cold. The temperature goes under 18 degrees. It'll give you a notification, and you'll go, oh, that's right, the window's still open. Go and close it, or something like that. But of course, if it's not measured and you don't get a notification, then how will you possibly know? And this is the data underlying it, which gets us to data privacy and security. So, because we are for the resident, we only have the address long enough to find the suburb that they live in and the census area. After that, we remove it. And we do that for security. Because if we're ever hacked, they can have all the data in the world, as long as they never are able to correlate that with an address. Because if you do, you can figure out when someone is home just on heat, or if someone's been away for a long period of time. This might need to change if we ever actually hit the commercial model, because we will have to start to deal with addresses associated with homes. Because if, I don't know, someplace funded you to have your set so that they could have an aggregate of that data, then they'd need to have the address that goes with it. But we will worry about that when we get there, one thing at a time. So we do anonymise where possible, and we also will provide an aggregate to, because we're open data proponents. Yeah. So we also have a rule that we will release a map of all of our data if there are at least 10 homes in a suburb that are on Whare Hauora. Anything less than that, you'll pretty much be able to figure out whose data is what. So, yeah. And we do that just for public good, and to see if maybe that will help in making decisions around prioritisation of suburbs for respiratory illness, say, or for, I don't know, we don't know, but we're going to do it. So, could Whare Hauora have helped my nan? Yes, we would have known. We would have known that she still had a cold, but her room was still under 18 degrees for long periods of time. That's the key thing, it's long periods of time. After she had died and we had stayed in her home for a week, I measured, because that's what guilt does to you. And her room was each night between 11 and 12 degrees. So I know for a fact. So, we keep going. 1/3 of all houses, one in six people have respiratory illness, the 3rd leading cause of death. That's something that we really have to fix. And so we're gonna, Whare Hauora's mission, and I'm putting it down to a year, I've got a year to do this, is to get whare sensors into every living and sleeping space in Aotearoa. That's 1.7 million homes. It's a lot of sensors. And so, of course, we have a scaling issue. Yeah, but of course, we'll get to that part when we get there. And there are some manufacturers that we have in New Zealand that want to help. And we have, remarkably, all of our PCBs, our printed circuitry, it's free. A place called Oshpark gives it to us. Our software has been built by volunteers. Everything that is tech-based has pretty much been given to us freely from people's time because they know the need and they see that we have to fix this. So yeah, Rabbit, Oshpark and Kahau, without which we really wouldn't be here. Yay, volunteers! Kia ora tātou.
Kia ora.